right, welcome back to the skeletal system with a focus on the axial skeleton. This is part 1B. So we are continuing to take a look at our cranium bones, and the next one is going to be our sphenoid bone. The sphenoid bone is very unique in its overall shape. It is often described as a bat-shaped bone. It will make up one of the fossas within the cranium. It is best viewed by removing the cranium cap, and when we do so, we see that it has a notable structure called the sella turcica. Sella turcica actually means camel's hump. It is a little depression that houses the pituitary gland. You will also notice that on your list for Chapter 7, our study guide, another notable structure will be the optic canals, which is what we're going to be utilizing for our cranial nerves to exit. So let's take a look at this uniquely shaped bone. So here you see it from the external anatomy on the right side. It is peeking through on the side view, right over there by the temporal bone in that beautiful pink color. And this view really gives us a good look at the notable structures. As you can see that the sphenoid bone by itself represents or looks like a bat. I think it looks more like a butterfly, but either or in its overall shape. And you can see the sella turcica in the middle, the little dip has been labeled for you. And if you want, you can take a look at the insert picture on the bottom right, and you'll see the brain sitting within the cranium, and the pituitary gland dangles ever so slightly below it, and it founds a perfect housing in that sella turcica. We also see the openings for the optic nerves right over there labeled by the optic canal. This particular image shows us the sphenoid bone removed from the rest of the cranium bones, and this really does give you that nice look at the bat shape / butterfly format of it. You can also see once again the labeling of the sella turcica and the optic canal. Finalizing our cranium bones will be the ethmoid bone. This one is unique because it is the deepest skull bone that we have, and it will give us some very notable structures, and the ones we're going to focus on will be the cribriform plate, the crista galli, and the perpendicular plate. Now, the cribriform plate and the crista galli are best seen when the skull cap is removed, and that will allow us to take a look at the attachment point that the brain's dura mater will utilize to keep the brain afloat within the cranium as it's surrounded by cerebral spinal fluid. The perpendicular plate is best observed by taking a look up the nasal cavity, where it will help us form our nasal septum. Here is a look at the ethmoid bone from an external view. As you can see, it is located next to your sphenoid bone and your lacrimal bone, which is in the green coloration. Once again, when we remove the skull cap, very similar to the sphenoid bone, you see a lot more detail of our ethmoid bone. And in this case, we see the cribriform plate and the crista galli. The crista galli will be an elevated section, and it will serve as the attachment point of the dura mater. So as the brain is sitting, it is wrapped around by meninges. The outer meninge is the dura mater, and it will allow the brain to float in its cerebral spinal fluid without hitting the sides of the cranium. Here you see the ethmoid bone completely removed, and this one gives us a really good look at the perpendicular plate, which, as you can see, will help us form our nasal septum. You can also take a look at the inserted picture at the bottom of the slide, where you see the dura mater interacting with the cranium and how it attaches to the crista galli towards the front of the cranium cavity. Now, previously we had seen our sutures, and I told you we would just kind of leave it on for a little bit, but now that we're more familiar with the cranium bones, I think it's an excellent time to revisit them. So, looking at my Chapter 7 study guide, I see that I need to know 4 sutures. And obviously there are many more, but these are the most common. We're going to have to know the coronal suture, a sagittal suture, the lambdoid suture, and the squamous suture. The coronal suture will allow us to fuse together our frontal bone and our parietal bone. The sagittal suture is exclusively for fusing together our two parietal bones. Our lambdoid suture is more towards the back. It will focus on the occipital and the parietal bones. And your squamous suture will be towards the side, focusing on the parietal and temporal bone fusion. Now, once again, a suture is just an immovable joint that will allow us to fuse these bones together. In this image, we can see our coronal suture. True to the name, it sits by your crown, which is the fusion of the frontal and the parietal bone. The squamous suture is located more laterally, allows the temporal bone to fuse to the parietal bone. The lambdoid suture is more towards the back, allows the interaction of the occipital bone with the parietal bone. And we're missing one, and that would be our sagittal suture, which allows the two parietal bones to fuse towards the top of the skull. Alrighty, so let's take a look at a few sample exam questions. This one will have us identify a specific structure and ask us which bone it belongs to. So it says, which bone houses the mastoid process and the styloid process? Your options are frontal bone, parietal bone, occipital bone, and temporal bone. And I hope we all selected the temporal bone. Let's take a look at another one. Which of the following can be found in the occipital bone? Will it be the crista galli, the jugular foramen, the foramen magnum, or our external acoustic meatus? Foramen magnum is our correct answer. That is our notable structure for our occipital bone. The crista galli is located by the ethmoid bone. The jugular foramen and our external acoustic meatus are both located by the temporal bone. How about this one? Which suture connects the frontal and parietal bones? So take a look at your options. Ooh, I hope everybody went with the coronal one. So hopefully these sample questions will give you an idea of how we can use descriptive language for our exam questions. Alrighty, so let's go ahead and continue on with our axial skeleton. And we're still on the skull, but now what we're going to do is we're going to switch over to our facial bones. So these bones will be located more towards the anterior part of the skull. And we're going to take a look at our mandible, our maxillary bones, our zygomatic bones, our nasal bones, lacrimal and palatine bones, our vomer, and then very briefly our inferior nasal congia. So collectively, these are the 14 bones that will make up our facial skeleton. All right, so here's a little sneak preview. As you can see, we are going to continue using our color code, and now we're moving away from the cranium location, and we're taking a look at the front of the face. So we can see some of the blue has been indicated for us to take a look at our nasal bone, lacrimal, zygomatic, maxilla, mandala, vomer, and your nasal congia. Here's a look with the mandible removed. We're going to take a look at this image because it will give us a really nice view of our hard palate, the roof of our oral cavity, to see which bones it involves. All right, so let's start off with the mandible. So I am now on the second page of my study review sheet, and I'm at the bottom part where it says facial bones, and it says mandible. For the location, it wants me to know it's my lower jawbone, and it's also the largest, strongest bone of the face. Fantastic. I also see that for the notable structure, I will need to be able to identify the coronoid process, my mandibular condyle, which is also called the condylar process. My alveolar process is the third item that I need to know on my list. So looking at my PowerPoint, it says that my coronoid process is known for having an insertion point for my temporalis muscle, which is a huge muscle that connects on the side of the face. The name is very familiar with the temporal bone because of the same location. And in our next chapter, we're going to talk about how the temporalis muscle helps us chew our food in an up and down pattern. The condylar process, also known as the mandibular condyle, will be an extension that fits directly into the mandibular fossa, which was introduced in the temporal bone. And the alveolar process, that is going to allow us to have little sockets or opening where our teeth will be housed in. So let's find this on our illustration. All right, so here you can see the mandible, bottom jaw, lower jaw. And if we take a look at this illustration, we're able to see our notable structures. We can see our condylar process on the left top, also known as our mandibular condyle. That is what's going to be inserting itself into the mandibular fossa. We can see our coronoid process, which is located towards the front of the mandibular condyle. That is going to be our attachment point for our temporalis muscle. And then we have our alveolar process, which will be our sockets for our teeth. Now, the upper jaw is called the maxillary bones, and it's two of them that are fused together. According to our list, for those, we're going to know obviously the location, but we're also going to know the fact that it has this notable structure called the palatine process. The palatine process is important because it's going to form the top part of our hard palate, which is the roof of our oral cavity. So if you take your tongue and you push it towards the top of your mouth, the roof that you're hitting right there, that is your hard palate. Now, 2/3 of it is the palatine process of the maxillary bone. You also have the alveolar process mentioned in the maxilla because once again, just like the mandible, it will be our housing mechanism for our teeth. So here you see the maxilla, and as you can see, there's two of them, one on the left and one on the right, fused together. And this inferior view where the mandible is removed allows us to see the hard palate. And as you can see, the hard palate, the roof of your oral cavity, is composed of the palatine process in that dark purple shade. And towards the back, you have more of a green coloration. And that is because that is going to be the palatine bone. That is a separate bone. So your hard palate, the roof of your mouth, is made out of two bones, the maxilla with its palatine process and the palatine bone with its horizontal plate. So here we see our maxilla by itself, gives us a nice look at our little alveolar process. All right. So our next few bones are bundled together. They are going to be our zygomatic bone, which is also known as our cheekbone, our nasal bone, which forms the bridge of our nose, the top part of our nose, and the lacrimal bone, which is associated with our tears because it houses the lacrimal sac, which is our tear sac. All right, now looking at my study guide, it tells me that for my zygomatic bone, I should definitely be able to describe it as my cheekbones. And the notable structure is going to be the temporal process. Now, the temporal process will be a bridge-like formation that will extend from the zygomatic bone over to the temporal bone. It's all in the name. Some of you might recall that in our previous presentation, we had the temporal bone with the zygomatic process, also a bridge-like formation, and these two processes allow the two bones, the temporal and the zygomatic bone, to connect together. Our nasal bone will be the top part of our nose. The bottom part of the nose is made of cartilage, so that's the wiggable part, the part that you can move side to side. And then the lacrimal bone is located within your eye socket. It has a little dip called the lacrimal fossa, and it will house the lacrimal sac. And the term lacrimal basically refers to tears. So it's a passageway for tears to drain. Let's find these on our illustrations. All right, so here we can see our zygomatic bone in blue. Look for your cheeks. We can find our lacrimal bone in green. And you see the little dip labeled the lacrimal fossa. And then we see on the tip of our nose, we have our, on the bridge of our nose, we have our nasal bone. All right, we're almost done with our facial bones. So let's go ahead and take a look at our palatine bone and the vomer. The palatine bone we just discussed recently when we were looking at our hard palate, the roof of our oral cavity. This bone will make up the back 1/3 of that location. The vomer is going to be located between the ethmoid and the maxilla, and this bone will also help us form our nasal septum. So here we have the illustration for our hard palate again. Notice the maxilla and the palatine working together to form that. And then the vomer is located directly behind in our bright blue color. And notice how it's wedged together, looking at our sphenoid bone and our ethmoid bone, which we don't really see from this illustration. Now, to finish off this particular section, we have a bone that's not really considered part of the skull, and it's not considered part of the skull because it actually doesn't articulate or make a connection with any other bone. It simply hangs in place due to ligaments. So this is called the hyoid bone. The hyoid bone lies underneath the mandible, and like I said, it's very unique because it doesn't make a connection with any other bones. Therefore, it's not considered an official bone of the skull. And an interesting fact is that it's often considered a sign of suffocation if a body were to be found where the mandible has been fractured or damaged. So that's a little interesting fact. Our final item for this part of the lecture, we'll take a look at what we call fontanelles. Fontanelles are the baby's soft spot. If you've ever held a newborn baby, you're going to notice that on top of their head, they have this small little dip that is called their soft spot. It is a fontanelle. The fontanelle is basically connective tissue that the occipital and facial bones will utilize to have a temporary connection, and over time it will start to solidify and ossifize into our sutures that we've discussed previously. So it will eventually become our coronal, our lambdoid, our sagittal, and squamous sutures. Now the fontanelles are very important because it will allow for the baby's skull to grow as it starts to develop and the brain to enlarge, and it will also allow for a little bit of wiggle room so that as the baby passes through the vaginal canal, the bones can slightly overlap, making it easier for the baby to be birthed. And this is why often some children are born with what they like to call a cone head. Nothing to panic about. It's just the pressure that was placed on the bones as the baby was passing through the vaginal canal. Within a few hours, the bones will reset and the fontanelles will allow them to continue to grow.